Vanakkam, good morning. In this video, we are going to discuss about the hypoxia. Hypoxia is the important short notes from the respiratory physiology. Hypoxia is defined as the decreased oxygen tension at tissue level. So hypoxia is divided into the four types. It is dependent on the some factors. When the oxygen tension in the arterial blood decreases, it produces the hypoxia, and the oxygen carrying capacity is decreases means it produces the anemic hypoxia. Any change in the velocity of the blood flow, it produces the stagnant hypoxia. The utilization of the oxygen by cells affected produces the histotoxic hypoxia. Hypoxia is the decreased oxygen tension in the arterial blood produces the hypoxia. It is otherwise called as the arterial hypoxia. It may be due to the lower oxygen tension in the inspired air. It may be occur in the high altitude or person living in the closed space. There the oxygen tension is low in the inspired air, and respiratory conditions decreases the pulmonary ventilation like asthma and depression of the respiratory center by the brain tumor and some drugs, suppressive drugs also produces the decreased pulmonary ventilation, and inadequate oxygenation in the blood in the lungs. Conditions like pulmonary edema and pneumothorax, these conditions alveolar oxygen is not diffused to the arterial blood. These conditions produce the hypoxia. Another one condition is the cardiac failure. The heart does not pump the blood enough to the oxygenation. So these are the clinical conditions. Hypoxia is occur. High altitude, closed space, asthma, pulmonary edema, cardiac failure. So in the hypoxia, PO2 in the arterial blood is decreases, and oxygen carrying capacity normal, velocity of the blood flow is normal, and utilization of the oxygen is also normal. The patient respond to the very well with the oxygen 100% oxygen therapy. In the anemic hypoxia, inability of blood to carry enough amount of the oxygen, so oxygen carrying capacity is reduced in the anemic hypoxia, but oxygen availability is normal. So it's mainly due to the decrease the number of the RBC. It may be due to the bone marrow disease or blood loss due to the hemorrhage. These conditions decrease number of RBC, so it decreases the oxygen carrying capacity. Other thing, decreased hemoglobin due to the alter the shape and size of the RBCs. It decreases the hemoglobin. That is also produces the anemic hypoxia. So it decreases the oxygen carrying capacity. And altered hemoglobin occur in the some poisoning conditions, cyanide, nitrate poisoning. It produces the methemoglobin. Methemoglobin is less affinity with the oxygen. So ferrous ion is converted to the ferric state. It cannot bind with the oxygen. So it is also produces the anemic hypoxia. And hemoglobin with carbon dioxide also produces the anemic hypoxia. And in the anemic hypoxia, arterial oxygen tension is normal, PO2 normal, but oxygen carrying capacity of the blood is reduced. Velocity of the blood flow is normal, and utilization of the oxygen by tissue also normal. The oxygen therapy responds 75%. The efficacy of the oxygen therapy is not 100%, only 75% in the anemic hypoxia. The stagnant hypoxia, velocity of the blood flow is decreased, mainly occur in the circulatory shock. So velocity of the blood flow is decreased in the circulatory shock. So oxygen is not available at the tissue level, and vasospasm decrease the vessel diameter in the vasospasm, so blood flow is decreased, and thrombosis formed within the vessel wall, so it affect the flow of the blood in the blood vessels, and emboli occlusion in the blood vessels also affect the blood flow within the blood vessels. So velocity is mainly decreases in the stagnant hypoxia, and oxygen tension is normal. Oxygen carrying capacity of the blood is normal. The efficacy of the oxygen therapy is less than 50% in the stagnant hypoxia. In the histotoxic hypoxia, inability to use the oxygen by tissue. It's mainly occur in the cyanide poisoning. The cyanide poisoning, the cytochrome oxidase level is completely decreased. So this will affect the oxygen utilization of the oxygen by the tissue. It will produce the histotoxic hypoxia, inability to of the tissue to utilize the oxygen. Effects of hypoxia. Due to the hypoxia, erythropoietin level is increased, so it will increases the RBC count. The blood pressure, heart rate initially increases, then decreases, and respiratory rate initially increases due to the chemoreceptor stimulation, then shallow, and urine is alkaline in nature. In the nausea, vomiting present in the GI symptoms. Disorientation is very common in hypoxia, and memory is impaired, weakness and muscle fatigue, lack of coordination, coma. If you not treated properly, it will lead to the death. Hypoxia treatment. Main treatment of hypoxia is the oxygen therapy. In the hypoxic hypoxia, oxygen therapy is 100% efficient. So the patient recover very well with the oxygen therapy. In the anemic hypoxia, oxygen therapy effectiveness only 70% because the oxygen carrying capacity is affected in the anemic hypoxia. In the stagnant hypoxia, efficacy of the oxygen therapy is less than 50% only, because the velocity of the blood flow is affected due to the diameter change in the diameter of the blood vessels or blood flow. So it is less than 50% effective. In the histotoxic hypoxia, the oxygen therapy is not useful. It is not useful because oxygen utilization of the tissue is affected due to the destruction of the cytochrome oxidase enzyme. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.